Welcome to session 3, part 3. Session 3, part 2, active and passive immunity. We will be seeing this topic first and move to vaccination, immunization, allergies, and autoimmunity, immune system in the body. Right? So, yes. So, what is active and passive immunity? When a host is exposed to antigens, which may be in the form of a living or dead microbes or other proteins, antibodies are produced in the host body. This type of immunity is called the active immunity. Active immunity is slow and takes time to give its full effective response. Active immunity injecting the microbes deliberately during immunization or infectious organisms gaining access into body during natural infection induce active immunity. Okay, when ready made antibodies are directly given to protect the body against foreign agents, it is called passive immunity. Do you know why mother's milk is considered very essential for the newborn infant? Okay, so the yellowish fluid colostrum secreted by mother during the initial days of lactation has abundant antibodies, which is IgA, uh, to protect the infant. The fetus also receives some antibodies from their mother through the placenta during pregnancy. So these are some examples of passive immunity. Okay, so it is very simple. What is active immunity, what is passive immunity? Okay, so active immunity takes time to give its full response. Injecting microbes during immunization or infectious organisms gaining access will trigger this, will induce the active immunity. And colostrum and antibodies from mother through placenta during pregnancy are examples of passive immunity. Now moving on to vaccination and immunization. So these are two very important things. The principle of immunization or vaccination is based on the property of memory of the immune system. In vaccination, a preparation of antigenic proteins of pathogen or inactivated or weakened pathogen. So in vaccination, a preparation of antigenic proteins of pathogens or inactivated or weakened pathogen vaccine are introduced into the body. The antibodies produced in the body against these antigens would neutralize the pathogenic agents during the actual infection. So the vaccines also generate memory B and T cells that recognize the pathogen quickly on subsequent exposure and overwhelm the invader with a massive production of antibodies. If a person is infected with some deadly microbes to which quick immune response is required, as in tetanus, we need to directly inject the performed antibodies or antitoxin, a preparation containing antibodies to the toxin. Even in case of snake bites, the injection which is given to patients contain performed antibodies against the snake venom. So this type of immunization is called as passive immunization. Okay, so passive immunization is basically giving antibodies artificially. Over here, passive immunity is because it was given from the mother's thing directly, right? Here it is passive immunization, injecting it. Okay, so recombinant DNA technology has allowed the production of antigenic polypeptides of pathogens in bacteria or yeast. So vaccine produced using this approach allows large scale production and hence greater availability for immunization. Hepatitis B vaccine produced from yeast. Okay, so the recombinant DNA technology, it allowed the production of antigenic polypeptides of pathogen in bacteria or yeast. So vaccine you produced using this approach allows large scale production and hence greater availability for immunization. So hepatitis B vaccine produced from yeast. Now moving on to allergies. So we know about allergies, and when you have gone to a place and suddenly you start sneezing, uh, when you have gone to a place and suddenly start sneezing for no explained reason, and when you went away your symptoms disappeared. Did this happen to you? Some of us are sensitive to some particles in the environment. The above mentioned reaction could be because of allergy to pollen, mites, etc. These which are different in different places. The exaggerated response of this immune system to a certain antigen present in the body is called allergy. So, the exaggerated response of the immune system to certain antigens present in the environment is called allergy. The substance to which an immune response is produced are called allergens. What is it called? Allergens. So, the antibodies produced to these are of IE type. So, we saw that colostrum IgA type. Over here it's IgE type. So common examples of allergens are mites in dust, pollen, animal dander. Symptoms of allergic reactions include sneezing, watery eyes, running nose, and difficulty in breathing. Sneezing, watery eyes, running nose, and difficulty in breathing. Allergy is due to the release of chemicals like histamine and serotonin from the mast cells. So, for determining the cause, so what does histamine do? Dilation and constriction, right? Serotonin constriction. So, for determining the cause of allergy, the patient is blood vessel dilation, okay, vasodilation, vasoconstriction. The patient is exposed or injected with small dose of possible allergens and the steroids, okay. So determining the cause of allergy, the patient is exposed to or to injected with small dose of possible allergens and the reaction study, the use of drugs like antihistamine, adrenaline, and steroids quickly reduce the symptoms of allergy. Somehow, modern day lifestyle has resulted in lowering of immunity and more sensitivity to allergens. More and more children in metro cities of India suffer from allergies and asthma due to sensitivity to the environment. This could be because of the protected environment provided early in life. So what they say is basically you should be exposed to everything. Okay, try to overcome hurdles. Just don't run away. Okay, or else you will always be caught in a trap. Right? Okay, so takeaway is active passive immunity. We have the colostrum IgA, active immunity, passive immunity. We also saw about the antibodies during placenta, through placenta during pregnancy, and then we also saw about vaccination, immunization. So vaccines, they generate memory of B and T cells, and then we saw about tetanus, directly inject the performed antibodies, okay, or antitoxins. So this is a preparation containing antibodies to the toxin, and even snake bites, such a thing happens. So this is known as passive immunization, right? Passive immunization. So now recombinant technology, it has allowed the production of the antigenic polypeptide of pathogen in bacteria or yeast. So yes, and hepatitis B vaccine is produced from yeast. And allergies, okay, allergies, we saw about allergies, allergens, and antibodies produced to these are of IgE type. And common examples of allergens are including sneezing, watery eyes, running nose, and difficulty in breathing. And then we saw histamine and serotonin, and we also saw about the steroids and other things, right? His antihistamine, adrenaline, and steroids to stop this over exaggerated uh, response. Okay, exaggerated response. And yes, so now we are in autoimmunity. Autoimmunity. Memory based acquired immunity evolved in higher vertebrates based on to based on the ability to differentiate foreign organisms, example pathogens, from self cells. While we still do not understand the basis of this, two corollaries of this ability have to be understood. One, higher vertebrates can distinguish foreign molecules as well as foreign organisms. Most of the experimental immunology deals with this aspect. So, too, sometimes due to genetic and other unknown reasons, the body attacks self cells. This results in the damage of the body and is known as autoimmune disease. So, rheumatoid arthritis, which affects many people in our society, is an autoimmune disease. Okay, so attacking self cells. Another thing is higher vertebrates can distinguish foreign molecules as well as foreign organisms. Okay, now coming to immune system in the body. The human immune system consists of lymphoids, organs, tissues, cells, and soluble molecules like antibodies. So, what does the human immune system consist of? It consists of lymphoid organs. Okay, it consists of lymphoid organs, tissues, cells, and soluble molecules like antibodies. As you have read, immune system is it's unique in the sense that it recognizes foreign antigens, responds to these, and remembers them. The immune system also plays an important role in allergic reactions, autoimmune disease, and organ transplants. So, lymphoid organs. These are the organs where origin and or maturation and proliferation of lymphocytes occur. The primary lymphoid organs are bone marrow and thymus, where immature lymphocyte differentiate into antigen sensitive lymphocyte. They differentiate into antigen sensitive lymphocyte. After mature lymphocyte migrate to secondary lymphoid organs like the spleen, lymph nodes, tonsils, Peyer's patch of small intestine, and appendix. Okay. So now the secondary lymphoid organs provide the sites for interaction of lymphocytes with the antigen, which then proliferates to become effector cells. The location of various lymphoid organs in the human body is shown. The bone marrow is the main lymphoid organ where the blood cells, including the lymphocytes, are produced. The thymus is a lobed organ. So the bone marrow is a main lymphoid organ where blood cells, including the lymphocytes, are produced. The bone marrow is the main lymphoid organ where all blood cells, including the lymphocyte, are produced. So, we already know that bone marrow is the main organ where lymphoids and lymphocytes are produced and mature over there, and this gets transferred into the secondary lymphoid organs where the interaction of lymphocytes with the antigens. Now, the bone marrow is the main lymphoid organs where blood cells, including lymphocytes, are produced. The thymus is a lobed organ located near the heart and beneath the breastbone. Okay. So, the thymus is quite large at the time of birth and keeps reducing in size with age, and by the time of puberty attains it reduces to a very small size. Both bone marrow and thymus provide microenvironments for the developing and maturation of T lymphocyte. Okay, so it is both the bone marrow and the thymus. So now the spleen is a large shaped organ. It mainly consists of lymphocyte. Okay, so lymphocytes and phagocyte, it acts as a filter of the body by trapping blood-borne microorganisms. So spleen has also a large reservoir of erythrocytes. The lymphocytes are small solid structures located at different points along the lymphatic system. Lymph nodes serve to trap the microorganisms or antigens which happen to get into the lymph and tissue fluid. Antigens trapped in the lymph nodes are responsible for the activation of the lymphocyte present there and cause the immune response. Now, there is a lymphoid tissue also located within the lining of the major tracts, respiratory, digestive, and urinogenital tracts, known as the mucosa associated lymphoid tissue, MALT. Okay, so it constitutes about 50% of the lymphoid tissue in human beings. So we saw that the bone marrow is where all cells are, lymphocytes and blood cells are produced. But the T lymphocyte matures in thymus. Okay, it just matures in thymus. B lymphocytes, it matures in bone marrow only. Then they go to secondary sensitive, secondary lymphoid organs also. We saw that. Now both bone marrow and thymus, they provide environments, micro environments for developing and maturation of the T lymphocytes. Okay, so T lymphocyte can mature in both also. Now the spleen is a large bean shaped organ. Okay, so it mainly consists of the lymphocytes and the phagocytes. Okay, it's a large, it's there on the stomach. Okay, it mainly consists of lymphocytes and the phagocytes. It acts as a filter of the blood and trapping. We know spleen is the graveyard of RBCs, right? So it traps the blood-borne microorganisms, and it has a spleen has a large reservoir of erythrocytes. It contains erythrocytes, lymphocytes, phagocytes, blood-borne microorganisms that are trapped, and the lymph nodes are small solid structures located at different points along the lymphatic system. Now these lymph nodes, they serve trap to the microorganisms or antigens which happen to get into the lymph and the tissue fluid. So this antigen trapped in the lymph nodes are responsible for activation of the lymphocyte present in there, and they cause the immune response. Okay, so there is a lymphoid tissue also located within the lining of the major tracts such as the respiratory, digestive, and urinogenital tracts. These are called as MALT. What is MALT? Mucus associated lymphoid tissue, MALT. It is 50% of the lymphoid tissue. Remember that. Okay, so it's very important. So I also want you to remember this lymph nodes, tonsil, space patch of small intestine, and spleen. Okay, which is over here, the secondary lymphoid organs. Thank you.